Hey, good afternoon. Welcome to CGH Medical Center. This is Bill Bird, Chief Medical Officer here at CGH. Thanks for joining me this afternoon for our Facebook Live broadcast. And yeah, I have, just as always, have some information, the latest and greatest with the pandemic and how things are shaking out here at CGH. So those of you in our communities are aware of what's going on. And then, of course, giving you some updates outside of CGH in terms of situations and, I guess you'd say, my perspective on that. So I'm going to start as usual. And then, of course, we'll have our shout outs and some of that kind of stuff too as we get towards the end. But I want to start with showing you some visuals. Okay. So that is from January 7th. And now the health department is sending something out once a week. So I bet you we'll get something tomorrow from them. But this was, it's like last Friday. And you can see the number of cases. And obviously we don't know what, there are probably way more cases than were even reported because of people doing home testing or just not testing at all and knowing that they have it. And you can see the positivity rate, hospital admissions, and all those type of things. So anyhow, that's one. And then Matt probably has some more stuff we want to show you here. This is Illinois and Whiteside County. You can kind of see how things have really clicked up here in the last week or two in terms of the cases. And I'll let you keep going here, Matt. Yep, hospital admissions, daily hospital admissions. Okay. Yeah, Whiteside County in terms of hospital admissions. Anything else, Matt? Okay. I actually will start there just in terms of a CGH perspective on all this. You'll see in that last chart actually had hospitalizations at CGH. And you saw, I don't know if you noticed this, but it showed that the graph was actually trending down. And from our perspective, this week has been much better than the number of hospitalizations last week. And we post that on you can find that on our website. But yeah, the number of hospitalizations, although still far higher than we like it to be, has definitely trended down somewhere between half to 2/3 what they were at the peak last week. I did see something, so that's really, we're really thankful for that. I did see something today which may be part of that explanation. I saw the CDC director mentioned that some of the deaths in particular that were occurring were happening in the last week or so were actually some of the tail end of it was also related to Delta. And I guess that does make sense if you think that from the time that someone gets infected to actually hospitalized to, unfortunately for some people, dying, it can be a few weeks. So we'll see. I just want to give you the information in terms of, is it going to stay that way here at CGH? We'll talk next week and I'll tell you where we're at, but I'm encouraged by at least the results right now. So yeah, I want to share that with you. And then some other pieces of information. In Chicago, I saw today that the number of cases has at least stabilized. It's not going up in Chicago. And given that we're not too far from Chicago, I'm hopeful that will be the case for us soon as well. In the Northeast, the cases are definitely trending down. In Boston, they check the wastewater, and in the wastewater, the viral particles, or however they check that stuff, is down 40%. So that's good. And obviously the Northeast flared first in terms of Omicron. But here in the upper Midwest, in region 5 of the upper Midwest, we weren't far behind them. So I'm hopeful that we'll see a similar trend for here in the upper Midwest too. The other piece of information that's still good news for people that are vaccinated is that whether it be Delta or now more commonly Omicron, the people that are getting hospitalized and the people that are dying from this very much tend to be folks who are unvaccinated versus those who are vaccinated, and particularly those who are vaccinated and boosted. So as always, it's never, from my perspective, it's still okay to get, and it's never too late, at least right now, to go ahead and begin that vaccination process or to go ahead and get your booster. I think another good piece of news is that as of right now, knock on my desk, there are no new variants of interest being reported by the World Health Organization. And every week that goes by that we don't have another variant of interest is a really good week. We'll see how that trends. I will say here at CGH, just like a lot of other businesses here in the area and businesses across the country and across the world, we have a lot of our own employees that have Omicron. They have it or they're having to quarantine because of exposure to others. So, we're managing the folks that are still here are doing a great job, but we've had to make some tweaks in terms of how we do things and appreciate your understanding as we work through this. One of the tweaks that we've made is that our Prophetstown Clinic and our Milledgeville Clinic are temporarily closed to divert staff resources to other clinics so we can better staff them. I don't see that as being a permanent thing, but just in the short term, wanted you to be aware of that, of what we've done to try to help with that. Another thing that we're doing here at the hospital, and we mentioned this last week when Dr. Steinke was on with us, we obviously have Ready Care. And so if you have concerning symptoms and don't feel the greatest, Ready Care is definitely an option for you to go to. We'll probably put up a number right now that kind of shows the number to call for Ready Care. But I will say, in addition to Ready Care, there you go, thanks. So you can call this number, and if Ready Care happens to have a really full slate of appointments, there are other options in our area that we serve here, whether that be Mount Carroll, Fulton, Morrison, Rock Falls, Walnut, I'm maybe missing one, that are doing Ready Care as well right now with this particular wave of infection. But start by calling the CGH Ready Care number and we'll get you in the right direction. But we're just trying to expand our services to help folks out. So wanted you to be aware of that as well. Okay. The other thing that becoming more and more clear with this Omicron variant is that there definitely are more people who have it who don't know it. In other words, they're asymptomatic and positive. What does that mean for you? I think what that means for you and what that means for me is when we are out and about in public, I think we should assume that there are folks nearby us who have Omicron and do not know it. So that means that it makes sense to wear a mask when you're in public places, so that can reduce your risk of getting the infection as you move around. I know I've talked about this earlier too. Oh, thanks. That's our positivity rate as of today. No surprise there in terms of that. So, and by the way, if I remember right, like the wave we had in November of 2020, I think our positivity rate got to just shy of 25% or at 25%. So a little bit above that positivity rate. Anyhow, where I was going that with mask wearing would also be if you're a high risk person, if you're unvaccinated and over the age of, let's say, 65, if you have other high risk factors, at least right now, if you're walking around in public spaces around people who are not wearing masks themselves, which seems to be a lot of public spaces right now, it wouldn't do you any harm to throw on a KN95 or an N95 mask just to kind of reduce your risk a little further. So I've been mentioning that already, but if you're a high risk person, I would definitely consider that at least right now. Okay, speaking of masks, CDC just saw this today, did not make any changes in terms of their mask recommendations. Overall, I think their philosophy is a mask is better than no mask at all. But I still go back to my previous comments that if you ratchet up your mask, if at least you're wearing a surgical mask, if you're a normal risk person, I think that's smarter in terms of reducing your risk than wearing a cloth mask by and large. So that's kind of where the CDC is at on that. And then I think this is the final thing I wanted to share with my information part of this, is that Health and Human Services made an announcement that they are going to be sending medical professionals through the National Disaster Medical Systems starting yesterday, a decompression unit to Javon Bay Hospital in Rockford. So to kind of help out with this particular variant and all the cases that we're having in hospitalizations. I don't know what that's going to mean in terms of for us or surrounding hospitals, but I'm sure we'll find out soon, and I'll let you know if how that all plays out, if there's more information to share about that next week. And I think we had some pre-call questions. If you want to put those up, Matt. Okay, so Marilyn was asking, if you're not vaccinated, what is best to get? And then second, third virus. Sure. So I'm not sure on the Gordy comment or flu shot. Okay, go back to that if you would, that question. I'd get both. So if we're asking which is better to get, a flu shot or a COVID vaccine, I'd get both. I feel really comfortable saying that would be your best bet. However, if you're like, I just don't want to do both, I'd get the COVID vaccination. So I would get Moderna or I'd get Pfizer. I'd get one of the mRNA ones. And that's what I would get if you were pinning me down, I'd say that. And then I'd probably get a flu shot. You can get it anytime after that you want to. There's no time frame when you have to wait to get a flu shot. So as soon as you feel comfortable getting a flu shot, I would get a flu shot after that. Yep, we are, Diana. Surgeries are still happening. Fortunately, we've been able to continue to do elective surgeries and emergency surgeries and any surgery that patients need. We've been able to continue to do those. So yes, those are still happening. And yep, that's all good. Okay, when will we have infusion for COVID patients again? Amanda is asking. So Amanda's talking about monoclonal antibodies. I don't know. So that's being allocated through the state, and there's a particular medication called sotrovimab, which is thought to be and believed to be effective for Omicron, and we used up our supply. We used it this week, and right now we don't have any of that. We're hopeful we'll get more, but we really don't know. I think we'll get some at some point in time. I'm just not sure when. When we do, what we will do is of course, I think we can put that on our website. We can put it on Facebook. And also what we always do here at the hospital is we let Ready Care and our primary care physicians aware of where our supply is at, so that when they have patients that call them, that they know whether that's an option for them. I will say, before we get to that question, I will say, as far as monoclonal antibodies go, the latest guidance I saw from the National Institutes of Health is because of the supply that we have, or lack of a great supply of monoclonal antibodies right now, that they're recommending to mainly give those to tier 1 people. And tier 1 at high risk people are folks who have had some type of organ transplant, so they're significantly immunocompromised. I think certain people that are on certain types of chemotherapy fall within that category. And if I remember right, and I'm pretty sure I do, it also is unvaccinated people over the age of 75 and vaccinated people who have significant other risk factors who are over the age of 65. So that's kind of our guidance to our medicals, to our primary care physicians, in terms of who are the patients they need to be identifying the best fit for getting that medication. And then that's my message to you as well. So we're going to try to do that as much as we can in terms of distributing that medication when we get it. And I'm going to go on from there and say that at some point in time, the oral medications, one's made by Pfizer. I think it's Paxlovid. I'm probably butchering the name, But anyhow, it's an oral antiviral that's put out by Pfizer, and then there's another oral antiviral put out by Merck, which are beginning to become available in a limited supply as well. And those, same situation where, at least right now, people that are tier 1 type of patients will be the ones that we will try to prioritize to get those medications. I will say that there are those medicines. The Pfizer one is supposed to be pretty effective. Like I've read like upper 80% effective in terms of Omicron, whereas the Merck one not as effective, or somewhere around 30% effective, 20 to 30%. So I think we're gonna target the Pfizer one as much as we can for patients, but the Pfizer one has quite a bit of. Our docs are gonna be, if they decide that you might be a good fit for that, there are definitely some drug-drug interactions that they'll have to make sure of before they prescribe that for you. So more information to come on that, but our medical staff, we're educating them so they're up to speed on the prescribing of those medications. Okay, good question. Are positive case numbers relevant anymore? Yeah, so, the positive case numbers it's just a data point. No, I mean, no is maybe a little strong, but we're far more interested right now in terms of people that are hospitalized. I guess the positive case numbers, would be relevant in the sense that every positive person is potentially an employee for the hospital, and that affects our ability to provide. That's why we have some clinics that are closed to kind of consolidate services. So positive cases matter in the fact that those people that are positive have to isolate and or quarantine. Hope that kind of answers your question. In terms of hospitalization, positive cases, no. In terms of trying to make things run, yeah. There was more to that question, maybe. Can we go back to that one? Yeah, good question. So with at-home tests more prevalent, those positive numbers, we're not catching all the people that are positive. And we're also not catching people that are positive and know it and don't even test. Seems to me the hospital should be the key. Yep, I agree with you. Whoever that viewer is, I agree with you. Okay, what was the next question? Okay, is somebody able still to pass on other people if they have symptoms still? So, yeah, the answer to that question is it's probably more about time frame that you've had symptoms for, rather than the symptoms lasting any particular length of time. So that's why we have an isolation period, and the CDC has this 5 days and then 5 days mask, and however you want to look at that. I still tend to look at it as a 10-day isolation period. And during that period of time, I think we should assume that anyone who has COVID symptoms that started up within 10 days ago is still shedding virus particles and could still spread that to other people. After that 10-day window, even if they still continue to have a cough, even if they still have taste or smell issues, not very likely to spread that to other people. Now, if they still had a fever, but in general, if you still have symptoms, like any infection, it's like if you had a bad case of bronchitis that's even not a COVID type of bronchitis, it's some other viral bronchitis, it's not uncommon at all for that person to be coughing a month after they had the infection. It doesn't mean they're spreading that infection to other people. So that was a good question. I appreciate that. Yeah, okay. Yep, okay, so I hear you. Particularly up until this Omicron, would you keep that up there so I can try to hit all those? Particularly up until Omicron, pretty much everybody in the hospital was in here because they had COVID. And yeah, they may have underlying conditions, but they were in here because of COVID. We're seeing with the asymptomatic COVID, asymptomatic Omicron situation, that we are getting more of a sprinkling of patients who show up who happen to be, oh, by the way, you're positive for COVID as well. we don't, we're just trying to take good care of people, and we're not, you know, we're not tracking those numbers to the percentages, but I would just say in general, I'll give you an in general answer. And in general, um, at least so far in terms of our hospitalizations, I would say that 90% plus are people who are in here because they have shortness of breath, they need oxygen, they have COVID. And then you have a smattering of folks who happen to have some other condition, and oh, by the way, they're COVID positive. So it's still trending pretty heavily towards people that actually have COVID symptoms. But you're right, there are some people who, as I mentioned earlier in this broadcast, who are asymptomatic and don't know it. Yeah, so Janice is asking about cloth masks being better than nothing. Yes, they are. CDC just came out with that today. And yeah, they're better than nothing. But surgical masks, I would say, are better than cloth masks. At least a three-pronged surgical mask are better than cloth masks in general. And a KN95 or an N95 are better than either one of those two options. So, yep, wear something. Wear as much as you think you can feel comfortable wearing, particularly if you're high risk in terms of those more advanced masks like the KN95 or the N95. Connie. Oh, yeah, I'm with you, Connie. Yep. So if you go to the drugstore and have a negative test, I'm with you. It's not perfect number. We are beyond perfect numbers, Connie. I just think I'm also pretty confident that we have a lot of cases. So, Amanda, when can I get my booster? I'm vaccinated. Oh, Jane. Okay. Yeah, if I remember, that's when I always have to look that one up, Amanda. But I think you're probably going to want to wait till you get through your active infection right now, which would be a couple weeks. And I think after a couple weeks, you would be a candidate to go ahead and get a booster shot. I will say, however, if you've just gotten this infection, and the odds right now that it's probably Omicron, given the percentages in the area, the need to get a booster isn't quite as pressing for at least probably a month or two, because you have some natural immunity from the infection itself. But yeah, I would say you get a couple weeks out, and our shot clinic and other places can answer in more detail about that question. I hope you do well, by the way, Amanda. Rebecca asked, are you able to transfer patients who need a higher level of care? It depends. By and large, it's still pretty tough to get people transferred. I was on a call yesterday with the Illinois Hospital Association, and it's still an issue. And we still have some of our level 1 trauma centers that are struggling to take on patients because of the number of patients they already have there and the number of patients that are boarded in emergency departments. So it continues to be an issue. I am hopeful that as the hospitalizations go down, and hopefully as a number of people that work in hospitals and their number of positives and having to be out of work because of isolation or quarantine go down, that our ability to transfer patients will improve. And also it's not impossible to transfer patients all the time, but it can be very challenging, very challenging. Donna. Yeah, good question, Donna. I don't have any great suggestions about how to make that happen outside of the hospital. We're doing our very best in our zone and our sphere of influence to be as diligent about having folks wear a mask as possible. But yeah, I don't have a great answer for you. Good question. I wish I had a better answer for you. Oh, and I guess my other answer, Donna, is if you're at high risk, and you're in those situations, I do feel pretty comfortable if I'm wearing a KN95 or N95 walking around. That not entirely, but very much reduces your risk of getting something because others aren't wearing a mask. What's the next question? Corey was asking. So Corey, yeah, I don't see. I just saw recently the non-hospitalized patient. I don't mean to contradict what you're saying, but I just saw the 4 drugs that are for non-hospitalized COVID patients and what the NIH recommends, and ivermectin wasn't 1 through 4. As far as ivermectin and use for hospitalized patients, right now the NIH has it kind of in that bucket of we're not going to say yes, we're not going to say no, because there just haven't been enough studies done one way or another to make that determination. My thought would be that I don't think ivermectin is a magic bullet, though. What do we have, Marianne? I appreciate it, Marianne. Appreciate your kind words. We're doing our best. I'm just trying to call it as I see it, and also the hospital just give you where we're at and how things are going, and answer your questions as best we can. Any other questions? Okay, so I have a couple things here. Want to do a shout out, first of all, for Colton Smith. Colton Smith is our CGH Employee of the Month. Congratulations, Colton. Colton is a pharmacy technician here at CGH. Does a great job. He always comes in. I know I coached Colton in Little League, so I've known Colton for a long time. And it's really nice to start to see, other than the fact that I'm getting quite a bit older, but it's nice to see folks that I knew since they were kids here at CGH and being part of things and doing great work. And it's great to have Colton here too. So want to give a shout out to Colton for his Employee of the Month award. And as I sign off, we're actually going to show you something that I thought was really, our marketing folks found this and had me take a look at it. It's kind of a cartoon version of talking about antigenic drift and how viruses replicate. And I thought that was pretty interesting. And it kind of explains why it's important that we do what we do in terms of our recommendations to our community. So that's going to come up after I sign off. Well, if you'd stay on, I think it's just a few minutes, the video, but I thought it was pretty interesting. And then for next week, we're going to, of course, give our updates as usual. And after we get done with the updates, I actually already did an interview with our new oncologist, Dr. Al Saeed, and really, I had a really good time talking with him. And we're going to post that interview for our Growing Healthy series next week after I give our usual COVID updates. Any other questions before I sign out for the week? Well, I'm with you, Donna. I'm cautiously optimistic that if Chicago's flattening out, and hospitalizations hopefully will begin to flatten out as well, that we could be trending in the right direction. So thanks, Mary. I appreciate your kind words. And you know what? I guess I do have one other thing to say. Our staff here at the hospital, folks that are taking care of, being part of taking care of you, whether that's medical staff, clinical staff, people behind the scenes that help the clinical folks do their work, have continued to do a great job throughout this pandemic. And my hat goes off to them as always, once again. Hey, until next week, have a great week, have a safe week, and we'll be back this time next week. Thank you.